welcome, Stephanie. Thanks for joining me this morning.
Hi, thanks for having me.
Yeah, perfect. So, I always like to start, just in case, I know you've been in the neighborhood as a resident for the last few years, but just in case people haven't gotten a chance to meet you, why don't you fill them in with a quick background?
Sure. My name's Stephanie Graziani. I've lived in Candelas for almost 4 years now. I'm over in Parkview. I have 2 kids. They're 4 and 6, and my 4-year-old goes to Goddard daycare, and my 6-year-old's at Three Creeks. Yeah. So it's exciting to meet a lot of the other parents of young kids.
Yeah, absolutely.
Yeah, and let's see, I've been an optometrist for about 12 years now and always worked for someone else, but very excited to be starting my own place, especially in the neighborhood.
Yeah, so why Candelas? Is it really you just wanted to have a practice in the community you were living yourself? I mean, how did you kind of come with selecting Candelas for your own practice?
Well, everyone who lives in Candelas wants more things around here, right? I mean, you have to drive 15 to 20 minutes to get to anything, especially when I moved in, when King Soopers wasn't even here. Yeah. So I just know that there's that want and need to have more things around here. And I know everyone's looking for restaurants and ice cream shops, but I feel like having an optometry office here would really bring a lot of benefits to the community. And plus, I'm just excited to be able to meet all the neighbors and get to know everyone. Yeah,
I mean, is there differing opinions, in whether it's optometry or dentistry of people opening a practice in their own community versus outside their community? I mean, is it 50-50, or do people tend to go the way you went, to where if it's doable, they'd rather have it in their own community?
I feel like most people would rather have it in their community. Usually it's just a lack of opportunity to do it where you live. Most people end up working somewhere and find a house somewhere else and then end up buying into where they're working, or it's just where the job opportunity is. But I had the time and I had the chance to try to figure things out, and I mean, the area is growing like crazy, so I knew we needed an optometrist in the area.
Yeah, and when we talked the other day, you mentioned, and this has kind of been a common theme of this interview series, is people kind of making the decision to do something, almost pivoting with the shutdown that we had from COVID last year, and you kind of fell into the same category, correct?
Yes. I was out of work for 2 months and home with the kids, and I was honestly bored and started making some phone calls, and I found out that there were a lot of resources out there for people starting their own businesses. And so, something that seemed impossible in the past suddenly seemed doable if I had other people helping me out. So started looking into it, and here we are a year later.
Yeah. Well, congratulations. That's a big decision, and we're grateful to have you. So you mentioned the grand opening. So you have a soft opening this week, and then things get started next week, correct?
Yeah, we've seen some close family and friends this week to try to work out the kinks. So in fact, I have an equipment person here who's working on getting everything connected, because I got the equipment that's all supposed to integrate so that I don't have to retype things in and possibly make mistakes. And it wasn't working how it was supposed to be, but as of about 10 minutes ago, it looks like it's working now. Yeah. So we have a couple other people coming in this afternoon. We'll test it out on them. We'll make sure everything's good to go by next week. So I'm going to start seeing patients, the real patients from the community on Monday. And then on Friday, we're doing our grand opening where, more of an open house really than a grand opening. Just want people to stop in. We're having free cupcakes to give out, drinks, hopefully some food and wine. I'm still trying to figure out if I need any kind of permit to get out wine, but hopefully. And we're doing a raffle with some of the neighborhood businesses that contributed things. So yeah, and it's going all day. So hopefully we won't have too many people all at once with COVID. Right. We are going to cap it, so not too many people can come in at once. But I think if people just stop in during the day, say hi, enter our raffle, grab a cupcake, that'd be fantastic.
So, fill people in, about, kind of the setup of your practice. I know talking to you the other day, you really have families in mind, and there's kind of alignment with how you have things set up with families. So can you share a little more about that?
Of course. Yeah, having young kids myself and knowing how many families there are in the community, I really wanted to have a place where people would feel comfortable bringing their kids in for an eye exam. And it's just so important to bring in kids. We'll talk about that a little bit more later, I'm sure. But so we set it up from right when you walk in. We have a table and coloring for kids. We have an exam room set up just for kids that we can put on movies if they're not looking in the right direction.
Yeah.
We have pictures of a dog and a llama with glasses on the wall, and just lots of very colorful things. And we have tons of kids' glasses too. We have almost 100 kids' frames out there. Yeah. So I'm hoping everyone, it just becomes a family-friendly adventure, really, that people come in for.
Yeah, I keep an eye on that llama picture if my daughter ever comes in. So
definitely point it out.
Yeah, but also something unique. You mentioned, is your practice is going to be very environmentally and eco-friendly. How's that coming about?
Well, it's something that has been coming along for the past 10 years or so. There's been a lot of frame lines that have come out that are made from things like wood or recycled ocean plastics. And so I started looking into how many frame lines there are, and we got over 30% of our frames out there are either made from eco-friendly materials, or they plant a tree for each frame bought. Many of them donate to nonprofits as well. So then it kind of sprung from there, where we have the frames that are eco-friendly, and we also want to encourage people, especially who live in the neighborhood, to either walk or bike or carpool to the office. And so if you walk, bike, or two people are set up for an exam at the same time, say husband and wife, or mother and kids come in, everyone gets $5 off towards a pair of glasses. Yeah. If they do that. So it's something that we're just trying to do our part. It's not something that we're overwhelming about, but I personally think that every little thing that people do can make a big difference. Right. So if we all just take little baby steps towards making our businesses more environmentally friendly, that it can go a long way. Yeah.
Well, and especially, being in the center hub of a family-oriented neighborhood, riding bikes and walking, isn't, right. Not as difficult or as challenging. And as you said, everybody just doing a little bit more goes a long way.
Exactly. And, make it a day. Come in, get your eyes exam, go to the dentist for your appointment, and then maybe go to Bluegrass or Resolute for food afterward.
Yeah, exactly. A little more about optometry and maybe some misconceptions is, I think people might, make the assumption that it's just, hey, you're having some vision problems and, you need to go get checked for maybe glasses, contacts, so on and so forth. But there's a lot more to it, and there's a lot more proactive and preemptive measures people should take, correct?
Yes, I feel like one of the biggest misconceptions within optometry is that people only think they need to come in if they're having trouble seeing. And certainly we can fix that if you're having trouble seeing. And certainly that is a lot of what we do, is fit people with glasses and contact lenses. But there's so much more to it. I don't know how many times I can tell you that people come in for an eye exam not having any problems. They're just there to renew their prescription, or their glasses broke, and then we find out that they have high blood pressure or untreated diabetes. And really, if you want one reason to get your eyes checked, it's for glaucoma. Glaucoma can happen, well, people sometimes are born with glaucoma, but typically if you develop it later on in life, it sometimes comes on by 40. And glaucoma is a potentially blinding disease that makes you lose your peripheral vision slowly over time. And so there's usually not any symptoms of it until it's very advanced. And then at that point, there's really nothing that we can do other than retain what you have. If you wait until you have symptoms of it, it's, you're probably going to go blind, unfortunately, and sometimes at a very young age. And same with diabetic retinopathy. Many times there's not symptoms. We don't have pain nerves in the back of our eyes. So a lot of times we don't feel if there's something going on back there. So just getting your eyes checked. The recommendation is every year before you turn 18, because kids' eyes can change pretty quickly and oftentimes they don't complain about it. Between the ages of 18 to 60, the recommendation is every 2 years if you're not a contact lens wearer or you don't have diabetes, and then after 60 every year because eye diseases become more common. And the second most common misconception I find is that people think that they need to go to urgent care or the emergency room if they have things like pink eye or a scratch in their eye or some kind of pain. And we treat all of that here. And many times we have much better equipment. If you go to the emergency room, they're probably just going to assume it's an infection and probably get you antibiotics. Yeah. But we will treat all that here. And I actually have it connected so that if you call our number and it's after hours, it forwards to my cell phone. So that if something's urgent and someone needs to be seen, then I live in the neighborhood, so I can try to see that afternoon. Yeah. And we even put it on our door Saturdays by appointment so that people know if it's the weekend and they need to get in, that I will most likely be able to find a time to be able to see you.
Yeah, absolutely. So, again, we're excited to have you opening up in the neighborhood, and again, being here 7 years this month. It's been great seeing, now that all the houses are mostly completed, seeing the businesses slowly, open. So again, we're excited to have you. I kind of like ending every interview with, something more that people are always surprised to hear about in your line of work or your profession. And you have one that actually resonated with me. So do you mind sharing that?
Of course. So no one in my family wore glasses. And when I was 7, I failed a school screening test. And my parents didn't really believe it because no one in our family has eye problems. But they took me into the eye doctor. He prescribed glasses. I got home, put them on, and my older brother, who was my hero, made fun of me. And I promptly never wore them. And lied to my parents saying that I was wearing them when I wasn't. And my teachers didn't even know I was supposed to be wearing glasses. And I got headaches that got worse in middle school, got pretty bad in high school. And it wasn't until I got to college and finally went back to the eye doctor and started wearing my glasses that my headaches went away. And so I think there are most likely other kids out there like me, although what surprises me is that really within a generation, glasses have become so much more popular. And to top it all off, my brother, when I got to optometry school, the one who made fun of my glasses when I was younger, had the nerve to ask me for fake glasses. And he swore that it made him look smarter when he was doing sales calls. Yeah. And now constantly kids come in lying to try to get glasses, or they'll cry if I say that they don't need glasses. Yeah. And so in one generation, it's right. Changed to where, when we grew up, it was, there was a negative stigmatism to it. And now, they're crying if if their vision's perfect. I know. It does make it easier for the kids who need glasses, which is, I think, better in the long run. But. Yeah. Well, thank you so much, Stephanie. Again, I've enjoyed the conversation. Where can people find you or find more information about Mountain Breeze? Well, the best thing to do would be to go to our website, which is mountainbreezeoptometry.com. Excuse me. We're also on Facebook and Instagram. And you can call our number anytime. They're now fully staffed and should be able to answer and call you back anytime. Yeah, well, now that most people have probably found out that they should be going to the eye doctor way more than they do, right. Hopefully the line will be out the door for you. So that would be great. We look forward to meeting everyone. So perfect. Well, thanks again. And then Candelas residents, make sure, if you can next Friday, get out to, that will be April 2nd, correct? Yes.
Yeah, get out to Mountain Breeze and have a cupcake, and if Stephanie gets permission, maybe a cocktail. And but yeah, I mean, let's support all these businesses opening up. So so again, thanks so much again, Stephanie. Good luck with the practice, and I will definitely see you next Friday.
Great, thank you.
Okay, thanks, Stephanie. Take care.
Bye-bye.